Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. The World Health Organization says HIV remains a public health issue. That is why the 2030 goal was set by the organization. Today on the program, we're taking a look at how each country, especially Nigeria, can align with this goal. Stay tuned. The conversation begins after this break.
The International Day of Persons with Disabilities is a reminder to all of us that health for all means all, including persons with disabilities. Around the world today, 1 in 6 people experience significant disability. Persons with disabilities face health inequities that can result in poor health outcomes, including premature death, a higher risk of diabetes, stroke or depression, and significant limitations in day-to-day functioning. Around the world, WHO is integrating disability issues in our technical work, and we're supporting countries to expand access to health services for persons with disabilities as part of their journey towards universal health coverage. But we also need to make sure we walk the talk. Through our policy on disability and the UN Disability Inclusion Strategy, WHO is working to ensure that persons with disabilities are an integral part of our workforce. I'm very proud of the progress we have made. We must continue this good work and continue to collaborate closely with persons with disabilities and their organizations as we work together for a healthier, safer, and fairer world for all.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Gbenga Adebayo, Chief Executive Officer, Livinghealth International, and he is going to share his expertise on how to reduce the burden of AIDS and how to achieve an AIDS-free society by 2030. Good evening, Dr. Adebayo, and thanks for joining us.
Thank you, madam. Thank you for having me.
All right, good evening. Let's reflect on the progress recorded so far and how, let's start with how Nigeria has fared since the country aligned with the 2030 goal set by the World Health Organization.
Well, I'd like to say that congratulations to Nigeria and the world at large, because HIV is not the same disease that we knew it to be in the 80s when we first had this scourge, when we first realized that we had a new disease and it was killing people. And then we had cases in Nigeria, and then of course the historical data is there. But what it used to be then is not what it is now. But sadly, a lot of people are still stuck with that mental image of what HIV is. One disease, one terrible, mysterious disease that kills anyone that gets it. Even if you go to the name of the HIV in our local languages, it's still in Yoruba language to be Arun, the Hausa language, in the Igbo language, there were connotations of that this is the end. Once you have this disease, that is the end. That is no longer the case. The modern advancement that we have with HIV has made it a very manageable condition. In fact, if you use your medicines as you should, you get diagnosed, have your diagnosis, start your medication and use it consistently over a period of 6 months, you're going to get to something that we call U is equal to U. That is undetectable is equal to untransmittable. That is the reality of HIV now. So HIV is not necessarily AIDS. That you have HIV does not mean that you must have AIDS. But people still call it HIV/AIDS, HIV/AIDS. No. HIV is not the same thing as AIDS. And as many people that have gone to know their status are on their medicine now, no. AIDS is not an endpoint. And that is why we want to say that by 2030, we want AIDS to be totally out of Nigeria. And if we continue raising awareness, so I want to congratulate you. Thank you so much for taking time out to raise awareness about the disease on this World AIDS Day. If we do what we need to do, we can fully kick AIDS out and reduce new infections, HIV.
Okay, I'm pleased to know that the awareness we have now is not what we used to have. But let's let our audience know what HIV is. What's the difference between HIV and AIDS? I think we should take it from there in terms of awareness.
Okay, thank you. Thank you. Well, you are totally correct. There are still, one would think that after about 34 years of HIV in Nigeria, that everybody should know enough. But there's still a lot of misinformation about what HIV is, about what AIDS is. So HIV simply is the name of a virus, which is the human immunodeficiency virus, and that's why we have the HIV. So it's a virus that is there, like any other virus. It attacks the human body, and it chooses the focal point of attack of HIV is the immune system of individuals. And your immune system is what is responsible for helping you to fight and ward off diseases. HIV attacks your immune system, especially the cells of your immune system that are responsible for fighting a lot of diseases, and it wreaks havoc on them. And it does this slowly over a period of time. It doesn't do it immediately. It's not 1 year, it's not 2 years, it's not 3 years, it's not even 5 years. About 10 years after somebody has HIV, without treatment, the person now has something that we call a syndrome. It's a disease syndrome, which is the AIDS, and it stands for acquired immunodeficiency syndrome. So AIDS, which is the acquired immunodeficiency syndrome, is the endpoint of this infection with HIV. And when somebody now has AIDS, the person loses weight. Any small infection, things that should not happen, rashes all over the skin, the person has fungal infections in the lung, has pneumonia from organisms that should not, even cancers, right? And all these things now any little thing can lead to the death of the person. So we want to prevent AIDS. Anyone that has HIV contracts HIV through whatever means. And people think that HIV is contracted only through sexual means. No, that's not the only way you can contract HIV. Yes, that is the predominant way HIV is transmitted, but anything that leads to transmission of blood and blood products can lead to HIV. So transmission of HIV. So pinpricks, blood transfusion, thankfully, in this age and time, we have enough screening modalities for blood that we don't have that. Organ transplantation, and the very, very important mode of transmission is the mother-to-child transmission, which is something that is still happening in our environment, but we can take care of it. So that's basically, I think, if we have further questions, we can try to dive into it. But basically, that's what HIV is and what AIDS is. So AIDS is not HIV. That somebody has HIV does not mean the person must have AIDS. And so we need to correct all those perceptions, because there's still a lot of misconception, and this misconception fuels stigma. It's unfortunate in this day and time that people still refuse to go to school with somebody that has HIV. They will say, my child cannot be in the same class with someone that has HIV. That just betrays ignorance about how HIV is transmitted. Someone says, I cannot use the same cup with someone that has HIV. That also betrays ignorance about, I can't hug someone that has HIV. That's not how HIV is transmitted. So if we know better about the disease, we will fight the stigma and discrimination that some may argue even kills faster, causes a higher burden than the virus itself does.
Okay, apart from stigmatization and discrimination, what is access to testing, screening also a challenge?
Yes, certainly. Because when people talk about this disease, what they think about is that it's not me, it's far from me, it cannot be me. It's not me that it can happen to. So, but the entry point to know if you have this disease is to be tested. We said that those slogans of many years ago when HIV was, we had a lot of come to work with HIV, was that HIV know they do what? You
Show
know
for
they
face.
show face. You know they show for face. So it's important that we get tested. And part of the beautiful things now about testing, unlike when we were in school those days, when people wanted to get tested, it took you days to know your results. So you are waiting, you are afraid. Now we also have the innovation of self-testing. Anyone can test themselves right in the comfort of their home. And it doesn't even have to use blood. Self-testing kits that use saliva are available, right? Available in pharmacies all around you. So this one is I think anyone can give themselves a good gift by getting tested. Just go to your pharmacy, local pharmacy around you, and get a self-testing kit. With your mouth, put it there, the description, how to use, very easy to use. In the comfort of your home, you can get tested. And if you are positive or negative, steps need to be taken. If you are negative, it doesn't mean that, oh, you have the jail-free card, you can now start to do anything you want. No. You still need to take preventive steps if you have not been doing so, right? So abstinence is still very, very useful. Be faithful to your partner is still a good message. And then condom use is still an important message that we need to get there. And then there are other innovations that maybe if time gives us, because we have pre-exposure prophylaxis, what we call PrEP, that some people can use, right, to protect themselves from contracting this virus. So a lot of innovations. Get tested. If you are negative, leave. Take the protective step. And if you are positive, it's not the end of the world. Start your medicine, and you will live a full, productive life. HIV is not a patient.
Okay, how close are we to the 2030 deadline set by the World Health Organization?
We are
Are we
close,
close at
and
all?
yet we are so far. That's what I would say. We are really close, and yet we are far. Why do we say we are far? Because that final milestone, we have a target that we call 95 target. That we want 95% of people that have HIV to know that they have HIV. 95% of those people that know, we want them to be on their medicine. And 95% of those people, we want them also to achieve what we call U is equal to U. So to now reach those final milestones, we have about 1.4 million people in Nigeria now that are on treatment. I'll be thankful thanks to the PEPFAR program, Global Fund, and other development agencies that are funding this. So, but we are so close, yet we are so far. We have a generation of people now that did not know about HIV. They did not know about AIDS. They didn't see it. And we have now what we call the digitalization of hookup culture. You can get to meet somebody to hook up with right from your phone right now. And a lot of this, we were at a workshop recently and discussing this communication and how people have lost sight of what it needs to be. And people are just hooking up, exchanging partners, and they are not following and practicing safe sex. So all the benefits and the hard work that we have had over these 34 years, we can lose it. And before we also have to talk about getting rid of AIDS by 2030, if we don't go back to not just taking care of treating people, but letting people know that this scourge is still there, this crisis has not gone away, and all hands need to be on deck.
Okay, are you hopeful of a treatment soon? And what do you think about recent advancements in the treatment and management of HIV?
Like I said earlier, the treatment is where we don't have cure yet. We don't have not at least not a cure that we can readily start to give everybody. But we know that a few people have had inadvertent cures when they were being treated for something else, and then they had a bone marrow transplant, and lo and behold, their HIV status was that they didn't have the virus anymore in their system. But that is not something that we're going to start to do for the millions of people that are living with HIV all over the world. So we don't have a cure, we don't have a vaccine, but we have very effective medicines that if you start to use them and you are consistent with them, within a very short period of time, your system is totally cleared of the virus. If you do a test, it will look like the virus is not there, but it is there. If you stop your medicines, it will rear its head again. So, and the medicines now, those days at the beginning, it was like you had a cup full of different tablets that you had to use. Now, no longer the case. One tablet daily, and you are good. So and then we also have innovations that we are thinking now. People can also take. So you are HIV positive, and you have a partner who is not positive. You have medicines that you can use before you meet with your partner that reduces, right? That eliminates, even virtually eliminates the risk of your partner getting the virus. So we have so many advancements. The key message that we like to say to people is please get ahead, know your status, and start treatment as soon as you discover it. Those days before, we say people should wait. They should wait until their CD4 count, that's the level of a particular type of cell in their body, was a particular level before they start medicine. No, not to wait. You start medicine immediately, and 6 months after you start your medicine, the virus will not be detectable in your blood anymore, your system anymore, at least by the very common testing methods that are there.
All right, your call to action going forward, what would you like to see differently about this deadline set by the World Health Organization?
We need to go back, for those of us in the public health space, we need to go back to the multi-sectoral response to HIV, right? So it's not just a clinical thing. We have been focused a lot, and to maybe because of what was necessary to get done at that time, to catch, test and treat. But we know that the HIV is a multidimensional disease. There are social components to it. There are gender and human rights components to it. There are societal community issues. So it's a social disease. So we need to get back to where we start to address it at the various ways. And the funny thing about as we address HIV is that we also address health systems. We strengthen reporting. We strengthen community self-efficacy of individuals as they take charge of their sexual and reproductive life. So we need to go back. And I'm happy that these are conversations that are now taking place at the important places, that we need to strengthen community action so that the young man there on TikTok understands what HIV better is, how to better protect himself, and we demystify and remove the myths and the wrong beliefs that he has about HIV. The people on campuses, that they understand what it is and what it is not. Not that you will have your bath after you have had intercourse and you are fine. No. So we need to go back, and then everyone needs to get tested. That's at the individual level. Get tested, know your status, and we will all be better.
Get tested, know your status, and we need to go for screening. HIV is not AIDS. Dr. Gbenga Adebayo, Chief Executive Officer, Livinghealth International, thank you so much for your time and expertise on sound health.
Thank you so much for having us.
All right, Sound Health continues with trending health report from around the world. Please stay tuned. It is still Sound Health on Lagos Television. More to come in a moment. Wow, the program has been Sound Health on Lagos Television. We have been discussing how to achieve an AIDS-free society by 2030. HIV is not AIDS. However, HIV could be managed. Key players are still working on treatment, cure, and all that. We are hopeful that one day, very soon, we will get a cure. For comments and inquiries, or you have topics to treat, please send SMS to 0035 826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.